Hey everyone, and welcome back to my channel. Today, we're re-diving into a topic that's S on every nursing student's mind: how to pass the NCLEX-RN in 2025. If you're re-gearing up for the big day, or just feeling a little overwhelmed about where to even begin, you've come to the right place. This video is your ultimate guide to the key strategies that will help you walk into that testing center with confidence and pass on your very first try. First things first, let's talk about the exam itself. The 2025 NCLEX continues with the Next Generation, or NGN, model. This means it's less about memorizing facts and more about testing your clinical judgment and critical thinking skills. You'll be facing case-based questions, unfolding clinical scenarios, and those tricky multiple response items that really make you think like a nurse. It's designed to see if you can make safe and effective decisions for your patients. So, how do you conquer it? It all starts with a strategic study plan. Don't just cram for hours on end. Create a consistent schedule that works for you. The key is practicing questions every single day, and when you get a question wrong, or even right, make sure you read and understand the rationales. That's where the real learning happens. I also recommend rotating your subjects. Don't get stuck on cardiology for a week straight. Mix it up with Med-Surg Pes and Psych to keep your brain sharp and engaged. Remember, it's not about how long you study, but how smartly you do it. Next, you need to master the clinical judgment model. This is the framework the NGN is built on. It sounds complicated, but it's what good nurses do every day. You recognize cues from your patient. You analyze those cues to figure out what's going on. You prioritize what needs to be addressed first. You generate solutions, you take action, and then you evaluate the outcomes. As you practice questions, constantly ask yourself, what's happening here? What information matters most, and what is my next best step? This mindset will be your secret weapon. Of course, you'll need some top-notch resources to guide you. You've probably heard of UWorld Archer Review and Simple Nursing. The NCSBN's official materials are also fantastic, and many students swear by Mark Klimek's lectures. My advice: don't spread yourself too thin by trying to use everything. Pick 2 or 3 high-quality resources and dive deep into them. Consistency is far more effective than trying to juggle a dozen different platforms. Now, let's talk about what to focus on. While you need a broad knowledge base, some topics are more heavily tested than others. High-yield content includes anything related to safety and prioritization. Think ABC's airway, breathing, circulation, Maslow's hierarchy of needs, and the nursing process. Pharmacology is huge, as is infection control. You'll also see a good amount of maternity and therapeutic communication questions. When you're studying, always try to understand the why behind every intervention. Why this medication? Why this position? This deeper understanding is crucial for tackling those complex scenario-based questions. Finally, and this might be the most important part, you have to manage your mindset. Test anxiety is real, and it can sabotage all your hard work. Prepare for the mental marathon by getting enough rest, staying hydrated, and practicing deep breathing exercises. Simulate test conditions by doing timed practice exams to build your stamina and get used to the pressure. When exam day arrives, trust in your preparation. You have put in the hours, you have done the work, and you are ready. You've got this. So, to recap, understand the next-gen format. Create a smart and consistent study plan. Learn to think critically using the clinical judgment model. Stick with a few quality resources, focus on high-yield topics, and maintain a calm, confident mindset. You have worked so incredibly hard to get to this point, and passing the NCLEX-RN is absolutely within your reach. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and share it with your fellow nursing students. Let me know in the comments what your biggest study goal is for this month. As always, stay confident, stay focused, and keep learning. You are going to be an amazing nurse.